Daybreak this week, we're bringing you the inside story on access to mental health care. Behavioral health experts say services are in high demand but aren't easily accessible. In a 5-part series, we're looking into the challenges people on Medicaid and Medicare face when getting help. News 8's Leah Hodges is live this morning to explain. Good morning.
Hey, Drew. Well, we have received, or hospitals, I should say, have received an alarming number of calls for help, in large part due to the COVID-19 pandemic. Living life with a mental illness can be very challenging. I would say that it can impact relationships with family and friends, including physical health. 988,000 adults in Indiana have a mental health condition. That's more than 4 times the population of Fort Wayne. These conditions range from anxiety and depression to prescription drug abuse and thoughts of suicide.
Anxiety and depression becoming more prevalent, more obvious to us. The last thing we want is for anybody to not get the help they need.
Covering Kids and Families of Indiana is a navigator to help people obtain health insurance. Medicare enrollment in Indiana stood at 1,277,996 people in 2020.
Medicare is something that's usually for adults who are 65 plus or some of those with certain disabilities.
But Medicaid is the largest public funder for health care in the nation, with more than 1,695,000 Hoosiers enrolled.
Which is traditionally for very, very low-income individuals, but also for women who are pregnant and children. They have a little bit easier access to that program.
Why is it challenging to receive care with so many people on Medicaid? Well, the insurance isn't easy to apply for.
It's easier to qualify for Medicare because traditionally, if you're in that 65 plus category, you're in. There's not income checks and balances and all the other things that you have to do with Medicaid that make it a lot more difficult to not just get it, but keep it.
Although people with Medicaid don't pay out of pocket to receive care, there aren't many healthcare providers who accept Medicaid because of low reimbursement rates, meaning Medicaid doesn't pay for the full cost of service to the provider.
So the provider is basically saying, I'll accept Medicaid patients. I know I'm going to make less on it, and I'm going to hope I can offset that elsewhere because I want to serve them, I want to provide the service, but I'm going to get a lower rate than I probably am from somebody paying on their own or from some private insurance.
And next, hear from a local man who has been searching nonstop for a provider that accepts Medicaid and Medicare, and he never gave up. That's tomorrow in part 2 of this series. Reporting live in Indianapolis, I'm Leah Hodges for Wish TV, wishtv.com.